So today's session is going to be about disability, and we're going to be talking about a few more topics. So as you guys remember from last week, we talked about behavioral disorders, and we thought that it might be useful to go in the same vein and talk about something which is quite interesting, but also quite relevant to today's society. So without further ado, let's start. So a disability is a mental or physical condition which makes it difficult for a person to undertake certain activities and or interact with the world around them. That's sort of a definition which encompasses the word disability, but we feel that it's a lot more than that, and it has quite a few different subsets which are important to be defined. The World Health Organization categorizes disability into primary, secondary, and tertiary dimensions, and we're going to talk about these dimensions now. One of them is impairment, so the initial detriment to a person's body structure of mental functioning, for example, the loss of a limb, the loss of vision, or possibly memory loss. The second dimension is activity limitation, so the direct consequence of having certain impairments is not being able to carry out certain activities or functions as someone without a disability might be able to. For example, they might have disability seeing, they might have difficulty in hearing or walking or solving problems as a person without a non-disabled person would take for granted or would be able to do those very easily. And they might have participation restrictions. So the wider consequence of disability on normal daily activities such as working, socializing, and playing. And this is just a little bit about the history of disability. So since ancient times, disability has been associated with sin and punishment. In certain cultures, the infanticide of disabled babies was common. However, a minority of civilizations normalized or even revered disability. In the UK, during the 1700s to 1800s, the ideas of lunatics and maniacs emerged. Now, I'm sure you guys have heard of these terms, and they're very derogatory terms in today's society, but we're going to talk about how that could actually affect people who may have certain disabilities and the negative and derogatory slang sort of terms that are used to describe certain people and how that might affect their mental well-being as well as, their daily lives. People with mental disabilities were commonly isolated from the rest of society and treated as outcasts. In addition to mental asylums, disabled people were sometimes put into circuses or even zoos. They were seen as something to be ridiculed instead of helped. And I'm sure you guys have heard of, there were lots of circus masters in history. For example, I don't know if anyone knows of P.T. Barnum, and that he was quite criticized at times for taking people who had certain disabilities or looked a certain way and put them into a circus and sort of paraded them as something of an oddity for the world to see and laugh at. In addition to mental asylums, disabled people were sometimes put into circuses, as we said, but the 1900s saw the emergence of the theory of eugenics. We did a previous session on eugenics, but we'll cover it, we'll do a little recap here. And the Nazi era saw the murder of almost 300,000 disabled people. In the late 20th century and early 2000s, disabled rights rapidly improved. The Paralympic Games was founded and services for disabled people became much more accessible and available. Slowly, our society is adapting to the needs of all people. So this is a it's a case study which we're going to go through, and Shivas and I are both going to go through this one. So Gavin, age 79, has recently been diagnosed with Alzheimer's disease. He has intermittent memory loss and often struggles to remember events and details from the past. Gavin has come into your hospital after struggling from a heart attack. You are able to treat him with drugs, but he remains unconscious and in an unstable condition. Unfortunately, you do not believe he will survive for another 24 hours. In 1999, Gavin made the decision that he did not want to donate his organs. However, he now tells you that he would like to change his mind. Despite this, a recent mental examination concluded that Gavin's dementia made him incompetent under the Mental Health Capacity Act to make important decisions. Therefore, you are forced to tell him that you are not able to follow through with his wishes. Now, this may seem like something we've actually done before, and we did talk about informed consent, the Mental Health Capacity Act, legally binding decisions, anticipated decisions, etc. So if you look into our previous sessions, you could actually think about those in detail and, have some sort of idea where we're going with this. Should people who have mental disabilities be allowed to make important medical decisions? So just in the chat, feel free to put some of your ideas about whether that's allowed or not. But it's quite an interesting topic, and it's quite a difficult one to think about. So does anyone have any suggestions?
And I think also while you're thinking about while you think about this topic and any suggestions you have, it's also important to consider the four pillars of medical ethics as well, which we've obviously covered in previous sessions. Um, but think especially about autonomy here, and in which cases it's right for autonomy to be restricted.
Yeah, so someone said, depending on their mental capacity, maybe discussing their decision with a family member first. Yes, people with mental disabilities should definitely be allowed to make their own medical decisions, preferably with the support of trusted friends or family, showing a clear understanding of their condition and in a safe environment. I mean, Shivas, correct me if I'm wrong. I think the second question, the second part is interesting. It says, yes, with people. That's not to say the first point wasn't interesting. We'll just come back to it in a few seconds. Yes, people with mental disabilities should definitely be allowed to make their own medical decisions, preferably with the support of trusted friends or family. Just to play devil's advocate here, for example, in this case study, Gavin made the decision before when he knew that, or he had a predefined assumption that in the future he might not be able to make decisions at the best of his ability. Just think about that. What if he made that decision specifically because he knew that in the future he wouldn't be medically capable or mentally capable under the Mental Health Capacity Act? Do you think he should still be allowed to change that decision? And do you think that's what the previous Gavin who made that decision that under informed consent would have wanted? Showing a clear understanding of their condition and in a safe environment. I think the idea of a safe environment is very good. I'm sure Shivas, what do you think, Shivas?
Well, I think it's interesting that you mentioned in that comment in a safe environment and showing a clear understanding of their condition. If we look at the case study, we're not really sure if Gavin is in, whether he does have a clear understanding of his condition and whether he knows about the extent to which this decision would, affect his life. So, a large part of autonomy is informed consent, the idea that patients are informed with all the necessary information in order to make a decision. And in this case, we're really just not sure whether he has that information in order to make a decision. So, it really is a battle here between autonomy and, information, and whether he actually is informed about the extent to which his decision would make an impact on his life. We've got another comment here, which is quite interesting as well, which says, as you said, this person has been tested and the examination concludes his inability to have capacity. So right now his decisions may not be valid. Yeah, and that's exactly what we're talking about. So, his decisions might not really reflect what he thinks or what he wants because he may not have capacity. But the question we're asking is whether that should limit a patient's autonomy, because autonomy is widely regarded to be the most important pillar of medicine and of medical ethics. A patient is, entitled to choose what they want and which treatment they want to receive. But, should that be limited? And also, who are we to judge whether that should be limited? We don't know if Gavin is, if what he's saying is a reflection of what he wants. So who are we, or who is the doctor in this situation to refuse that treatment because they don't know whether that's what the patient wants or not?
Yeah, so does anyone else have any other ideas? Because I mean, we did talk about legally binding decisions in the past, and it's quite important to realize that obviously it's not mentioned if anyone has power of attorney here. And if someone does have power of attorney, then they can change that decision because that person would have been chosen by Gavin when he was mentally capable under the Mental Health Capacity Act to make decisions on his behalf, because Gavin knew that he would make the best decision possible, or he or she would make the best decision possible. So there are lots of unknowns here, and it's quite difficult to say if people who have mental disabilities should be allowed to make important medical decisions, especially if they've already made one in the past, anticipating this very occurrence.
There's an interesting comment that's been made here, and I think this is exactly what a doctor would do in this situation. Someone's written, as Gavin made this decision before, maybe you could ask him why he changed his mind and if he's sure. If he's still persistent, then it should be discussed with a trusted family member. So I completely agree with that. And I think in order to really ascertain whether he wants to make this decision or not. You should ask him his reasons for wanting this decision. If he's able to really explain why and explain why he's changed his opinion, and what caused him to do that, then perhaps you'd be able to realize whether that's a decision he actually wants, or whether it's perhaps caused by a certain, his inability to make a decision in terms of his mental capacity. And of course, family members would definitely come into play here. We have discussed competence, Gillett competence, power of attorney before, but I think in any case, it would be wise to have a discussion with family members in order to see whether they know anything about his wishes. So yeah, thank you everyone for your comments there. Siddhant's just had to leave quickly, but we'll continue the session regardless. So we've got another case study which is quite similar, and it's to do with the ability for disabled people to access certain healthcare. So we've got just a case study, and I'll just read it through and then we can discuss it. Eliza, aged 40, has recently been diagnosed with a severe cognitive disability which affects her ability to speak. She lives in a specialist care home and requires full-time assistance for basic daily tasks. Eliza recently came into your hospital after falling unconscious and wheezing. You, the doctor, realize she needs immediate access to a life support machine. However, John, a 14-year-old boy, has experienced lung damage after being hit by a car. He also requires a life support machine, but there's only one left in the hospital. Neither patient can be transferred to another hospital in time to save them, and the boy's parents beg you to keep alive because they tell you that his older brother died last year in a skiing accident and they cannot bear to lose another child. Now, obviously, this case study is somewhat unrealistic in regards to the fact that, there's only one life support machine, but the principle of this case study is that if there are two people who need to be treated and require urgent treatment, but one is disabled, then should they be prioritized or not over the other patient? And this is to do with the equality of access to healthcare. One of the founding pillars of the NHS is to provide all patients with equal opportunity to treatment, without taking into account their ability to pay, for example. So we've got a couple of questions here, and I think maybe put your answers in the chat. Just think about what you would do in this situation if you were a doctor. If you had to pick a patient in this situation, would you take into account the fact that Eliza is disabled? Would that impact your decision, or would you not base that? Would that not be a part of your decision? Would you look at perhaps their medical need instead? So someone said, medical ethics considered, other options for treatment should be considered as well. Are there any alternative methods? Right, yes, and obviously this case study is very limiting in the fact that it only, gives us a small bit of information and kind of one decision to be made. But in real life, there would obviously be a variety of treatments which would be available. Perhaps John could undergo surgery instead. He doesn't need a life support machine, or he could be transferred to another hospital, or actually it does say he can't be transferred in time, but still there will be a variety of treatments which are available, which I'm sure could be looked into. Somebody said the individual family situation, etc., of each patient shouldn't really be a factor in our decision. The life support machine should be given solely based on who has the most severe, unstable state right now. Although John's family situation is really sad, we cannot base a medical decision on that. And I think that's true. And I think that is what a doctor would have to do in this situation. It is very sad, but from a medical perspective, from a professional perspective, that can't be something which influences a decision. And I think, the general consensus is here that, all patients should be entitled to equal treatment, and disability should not be a factor that affects whether a doctor wants to provide treatment or should provide treatment. In this case, we've got someone saying, in this case, I would not consider Eliza being disabled, nor that John's older brother died as factors contributing to my decision. Yes, and as many people have said, that would be unprofessional. It should be based on medical and clinical need rather than anything else. And someone has mentioned quality of life of each patient. That links to futility as well, which is something we'll cover in a couple of slides' time. But yes, which patient would benefit from the treatment more? Which patient would the treatment be most effective for? Have the least side effects? those are the factors that doctors should be considering. Right, so I think we'll move on now and talk a bit about ableism, which is something you might have heard of before. And it's basically to do with the fact that, disabled people face discrimination and social prejudices based on the belief that typical abilities are superior. And this does tie into eugenics and those ideas as well. But people believe that in today's society, certain conditions, visual impairment, deafness, autism, they shouldn't be classified as disabilities because their needs can be accommodated for and they're able to live normal lives. And some examples are, wheelchair users. They're only unable to access a building due to the presence of stairs and lack of a ramp. So their condition can be accommodated for, and it's the same with deaf people. If British Sign Language is more commonly taught in schools, then their ability to communicate would not really be affected. So with this in mind, we're going to look at an article which was from quite a long time ago, but it's to do with the fact that people sometimes will want to have children with certain disabilities. For example, there was a couple quite a while ago who wanted to have a deaf child. And this is to do with the fact that deafness is sometimes viewed as a linguistic minority rather than a disability. And therefore, the way to reduce the social stigma and lack of accommodation towards deaf people is by its normalization, its acceptance, rather than its treatment. So we've got a few questions here. Is it ethical to want to have deaf children or even induce deafness in children, which is possible today with our technology? And also, should disabled people be allowed to be parents? Who should be able to make that decision? Also, should deafness even be classified as a disability? Should it be just a linguistic minority instead? So we've got a few points to consider here surrounding deafness. And please do put any ideas you have in the chat regarding this, possibly relating to any of these three questions. And if you'd like, please do also unmute yourself and speak out loud if you'd like to express your views via the microphone. So someone said, some may consider it as interfering with nature or God's plan to cause a deaf child to be born. That's very true, but I think that's the case in a lot of medical treatments today. A lot of the treatments that are provided in hospitals do sort of go against nature. Some people might argue that abortion is against nature. And so, that argument could be applied to many scenarios, but yes, I see what you mean. Please do raise your hand if you want to speak out loud as well. We'd be very happy to listen to that. Someone said disabilities may not be as limiting if it's normalized and society grants more access to them. Yeah, that's very true. And as we said, if society adapts to these people, then those conditions aren't necessarily disabilities because it's not enabling them, it's not preventing them from carrying out normal activities. Someone said, in my opinion, it isn't ethical to want to have deaf children, although in an ideal world they can be accommodated for. The sad reality is that it's really difficult for most deaf children to access the same opportunities as other children. Yeah, that's true. And some people might argue that it's unethical because it would limit their ability to take part in regular activities. Although it is possible to accommodate for these people, that isn't always the case in today's society, and they would clearly face several detriments. Someone said, for disabled parents, I think it should be dependent on their mental capacity. However, I don't think that they shouldn't be allowed to be parents just because they are disabled. Yeah, and also a big ethical issue there would be who would make that decision. Is it right if the government were to enforce that, or if hospitals were to enforce that, were to, ban people from having children based on the fact that they have a disability? That would, of course, raise a huge ethical issue. And that does, again, link to the idea of, eugenics, the idea that disability and deafness is something which should be kept separate from society, isn't something that should be promoted or normalized. Someone said, I think it is ethical to want to have a deaf child, but if a child is conceived and is not deaf, then aborting the child who is not deaf because they want a deaf child is unethical. Right, so I see what you're saying here, and perhaps what you could argue as ethical is that, you know, having a child, regardless of whether they're deaf or not, is something which should be accepted and normalized, rather than, you know, specifically wanting a deaf child, and not any alternative. Right, so we've got a lot of people generally agreeing that, you know, deaf people should be parents, and it's not unethical to want a deaf child. And a lot of people, someone said here, but imagine if a majority of the population want disabled children, how would this affect society? The biological fitness of offspring would be very low, leading to the inability to reproduce and survive. Yes, that's very true. But again, this theory is what really started eugenics, the idea of having a pure and fit society. And that obviously led to, as we discussed earlier, a huge amount of death, especially in the Second World War. But I completely understand your point in the sense that if we were promoting disability without the necessary steps in our society, the necessary facilities in our society to accommodate them, then that obviously would lead to detriment in the people who live here. People aren't able to access the same opportunities, and of course the general fitness of the population would be lower. So it is a difficult discussion to have, and there are strong points on either side of the argument. So I think we'll move on from here. I don't know if anyone wanted to speak out loud there, but okay, that's fine. We'll move on. And we'll talk a bit about abortion now, which we have touched on before. But currently in the UK, the Abortion Act does mean that pregnancies can be terminated if there's a significant risk of the baby being born disabled. And certain conditions, such as Down syndrome, are able to be detected during pregnancy. And studies show that the incidence of abortion of these babies is higher, despite the fact that many people who have Down syndrome are now able to lead perfectly fulfilling lives. So these are similar questions to what we just discussed. But is it ethical to terminate a pregnancy on grounds of disability? And also, do you think screening for disabilities whilst pregnant should be banned? And again, who should be able to decide whether a baby should be terminated or not? So these are similar questions to what we've asked before, but I think maybe we should focus specifically on the second question. Should screening for disabilities be banned? Is it ethical to actually find out whether the child has a disability? And it's a similar thing with gender as well, or rather sex. So in many hospitals now, it isn't allowed for parents to actually find out the sex of their baby. I know that at the hospital where I was born, my parents weren't able to determine my gender because it wasn't allowed by the hospital. And a large part of that is to do with abortion, and it's because they don't want parents to not want a baby because of its gender. So there are many issues that can cause, and perhaps we should see a similar approach in terms of disability. If disability isn't seen as something you can get rid of, if parents are almost forced to accept it, then that could lead to greater acceptance in society overall. So someone said, some people support abortion, some people do not. I believe it is always up to the mother if she wants to terminate a pregnancy because she knows her own mental and physical state. I think that's a consensus which is quite common in our society, although I would definitely recommend that you look at our video on YouTube about pregnancy from a previous session if you didn't attend it, because we do discuss the idea of abortion in a bit more detail, and whether it's right to terminate a pregnancy just from the mother's decision, or perhaps whether other people should have an influence in that decision as well. Someone said it depends on what the parents think. If the child is likely to be seriously diseased or deformed, the parents may not want to suffer grief of losing that child or seeing them in pain. Yeah, I completely understand your point there, and that's the reason why many people choose to terminate the baby. Someone said, "May I speak?" Please do go ahead. Please unmute yourself, and we'd love to hear your ideas.
Hi, I think the couple can be prepared to handle it and like mentally prepared to raise the child with, if it does have a disability, if they know beforehand.
Okay, Thank you very much. I think that is, yeah, that is a view which is shared by quite a few people, and especially if they're financially able to provide for the baby, if they're able to raise it, and they have the facilities to take care of that baby, then many would argue, why not? Why shouldn't they? Because otherwise that is essentially discriminating against them. So yeah, thank you for that. And I think someone has said, I think screening for disabilities can be really helpful for the mother mentally, giving security and ability to plan for a child with more needs. It can also help the doctors make the pregnancy easier and more comfortable and medically safe for the mother. Right, I understand what you're saying here, because the reason for screening for babies is often not you know, to see whether the parents want that child or not. It's to do with the idea of preparing for that pregnancy, preparing for the needs of the child. And it's a similar thing with screening for a baby's gender. It's, you know, to prepare for that gender, you know, think of a name perhaps, or something like that. But it's a similar thing with disabilities, and it's perhaps more important with disabilities to be able to know in advance. You're able to have the financial ability to take care of them, and, you know, prepare in certain ways. Yeah, thank you very much. I don't know if anyone else wants to add any more comments. If not, then perhaps we'll move on to the next slide. Right, so this is a very interesting issue. It's called the Charlie Gard case, and it was quite a popular story in the news when it happened. And this is to do with the idea of disability, and it raises a lot of ethical issues, really. So it's something we're going to discuss a little bit. I'll just read it out, and then we'll think of a few questions surrounding it. So Charlie Gard was born in 2016 with an extremely rare genetic condition called encephalomyopathic mitochondrial DNA depletion syndrome, or MDDS, which causes brain damage and muscle failure. He was admitted to Great Ormond Street Hospital after his health began to deteriorate. Doctors eventually suggested that his life support be turned off, as any further treatment was futile. Charlie's parents campaigned for Charlie to be brought to the USA to receive an experimental treatment based on nucleoside supplementation, and received over £1.3 million. However, Great Ormond Street Hospital overrode this decision and questioned whether the treatment would be worthwhile considering Charlie's brain damage. After weeks of legal battles, Charlie's condition worsened, as it was deemed that no treatment would be successful. Charlie's life support was removed, and he passed away a week before his first birthday. So we can see here that there are many kind of issues that we can discuss regarding whether, you know, the treatment of people who have disabilities, who should decide whether they should be treated, and also whether these decisions should be overridden. So the first question we've got here is whether it's ethical for experimental treatments to be carried out on people with disabilities. This is something we discussed in our sessions on pregnancy, on our session on drugs as well, whether it's right for parents to be, you know, pregnant people to have certain trials carried out on them, and also people with disabilities. If these people are vulnerable, then trials could damage them. So regarding that first question, does anyone have any ideas they'd like to add? And also, if you'd like to unmute yourself and speak out loud, please do. We'd be very happy to hear your ideas. Someone said, it depends on whether the disabled person is comfortable with it or a trusted guardian or family member allows it. Yeah, and that brings us back to the idea of autonomy. But in this case, it's very interesting because it was obviously a baby who was going to receive this treatment, and you know, babies aren't able to express their own autonomy. Babies aren't able to make decisions for themselves. So it was down to the parents in this case. And if they do allow it, then is that right to be able to allow an experimental treatment to be carried out on their child if they have a disability, especially if it hasn't been trialed before, whether it's not known if this treatment is safe or not? Someone said, I think that experimental treatments with the right precautions can be a last resort if the person's condition is deteriorating and they have no other option. Okay, that's an interesting point, because in this case it was really a last resort, but it became too late to undertake, and Charlie did die. We don't know if that treatment would have worked on him, but so it's a bit tricky to know the answer. But the thing is, many would argue that in terms of beneficence and non-maleficence, these other medical pillars, it's not right to withhold these treatments when they could create a strong effect, they could work, and there is no other option. Someone said, because otherwise they don't test treatments, how are they meant to know if it will work? Yeah, that's very true, and that's the whole reason why there's so much controversy surrounding these experimental treatments. I don't know if anyone has heard of the thalidomide scandal, which happened quite a while ago. We did cover it in a previous session, but it was essentially a trial of a certain drug on pregnant women, which caused very severe abnormalities in the babies, very severe deformities, and these babies grew up with really small limbs and a severe cognitive impact as well. And that was seen as, a real horror story in the medical world, because these drugs were trialed on pregnant women, and the drug was unsuccessful. It caused a whole generation of babies to be born with severe disabilities, and that is perhaps a reason why it's so risky to trial experimental treatments on people who are vulnerable and who could be affected on it. It's difficult to trial these treatments in the normal way, which is to test them on healthy volunteers, because we don't know if that will necessarily have an impact. So it is very tricky to create a balance between trialing drugs and also ensuring that people stay safe. Someone said, Great Ormond Street Hospital obviously overrode the patient's wishes for good reasons. The medically trained experts, they are medically trained experts and act upon the medical ethics, hence made a decision with the best interests. However, we still have to respect the parents' ideas. Okay, so that's interesting. Do you think in this situation they shouldn't have been able to override the decision? If we look at autonomy, do you think that it should have been the parents' decision and their decision alone, even if they didn't respect the ideas of the medical experts? Someone said, I'm sure Great Ormond Street Hospital had a reason to oppose the treatment, but a legal battle to prevent the parents from deciding doesn't really give much autonomy to the family. So that raises a question of whether it's right for parents to express their autonomy, even if it goes against what a doctor thinks is right. As we said before, autonomy is widely considered to be the most important pillar of medical ethics, but should that be allowed to be expressed if it goes against the doctor's wishes, or goes against what a doctor think is right? That's the kind of battle between beneficence, non-maleficence, and autonomy, and even justice as well. I know Siddhant has rejoined the meeting, so if you have any comments you'd like to add, please do add them. Someone said, if there is an experimental treatment out there for a condition, it has often gone through years of trial and peer review, so it'll be relatively safe. Well, if it's experimental, then it might not necessarily have gone through these, so much trial. And in this case, certainly, if the treatment was experimental, and that's why Great Ormond Street didn't suggest that it would be worthwhile. Someone said, how may the pillar of justice play into this? Okay, so there are many ways in which justice might play into this in terms of experimental treatments. Some people believe that all patients should be entitled to the same quality of care, and therefore you could argue that allowing patients to have experimental treatments means that people who are disabled, who are vulnerable, are able to access care which people who don't have these conditions are able to access, therefore providing a wider range of treatments available and ensuring more people have access to certain medical treatments. That's perhaps one way it could lead to justice. And also, you might argue that if these trials are undertaken, then it would lead to future generations having access to drugs, and therefore, causing a larger benefit in terms of the health of the society as a whole. Sinan, do you have anything you'd like to add so far?
No, I think the points that were made were very, very good. And I think the important, like, as you mentioned, the battle between autonomy, maleficence, and non-maleficence and beneficence is very, very important and very, very relevant, especially because, you know, the entire thing with autonomy clashing sometimes with the beneficence that a doctor knows is true for a patient is very, very important to understand. And especially as you go into the medical field, or everyone that comes here goes into the medical field, then they will understand that, you know, sometimes it's difficult to cross that line.
Mm-hmm. Yeah, and I think someone's asked the question, did Great Ormond Street provide a public statement as to why they overrode the decision? I think in this situation, it was to do with the idea of futility, the fact that they didn't believe that it would be worth having this decision considering the brain damage that had already been caused to Charlie. And I don't know how many people here are know about the idea of futility. It is something we had a session on quite a while ago. But it links to the third question we've got down here about qualitative and quantitative futility. Just out of interest, does anyone know what these two concepts mean? If you'd like to just, you know, put them in the chat, please do, and then we'll discuss them a bit more. Perhaps, you know, if you could just give a brief definition of either of these terms. Or even if you'd like to unmute yourself and explain out loud, then we'd be very happy. So yeah, so the two terms quantitative and qualitative futility, or if you just know what futility in general means, then please do explain that. Someone said, if the parent should ultimately be allowed to make decisions, then what is the point of doctors going through years and years of studying and training? They've obviously had this amount of training, so they're able to act in a patient's best interests. Okay, so that's an interesting point, and that's what we were mentioning before, the idea of autonomy versus beneficence and non-maleficence. You're right, you know, doctors have gone through so many years of medical school. They're obviously experienced, and they know from a medical perspective what would have the best outcome on their patients. However, is it right for a doctor to directly influence a patient's well-being, their body, their health, if it's not their own body or you know, their own health that they're impacting? Many people would argue that that should be the patient's choice and the patient's choice alone. And that does link back to the idea of informed consent. You know, a doctor should provide the information and give the range of options that are available. They should provide their opinion on which treatments are the best and may have the best outcome for the patient, but then it should be the patient's idea alone. So going back to futility, Sidan, I wonder if you can explain perhaps those two. I think some people put their ideas in the chat as well. Oh, I think you're muted.
Yeah, sorry. So futility, we did a session on this a couple of weeks ago, but basically futility is the idea that, you know, if in the end one thing is more of a triumphant variable than the other, then why should one variable matter at all? And, you know, the idea where I don't exactly remember the definitions between qualitative and quantitative futility, if I'm completely honest, but I do remember discussing, for example, like we just mentioned here, the difficulty between if parents should be allowed to make decisions for their children, but it might be wrong, or maybe based on studies or evidence which are not entirely true, then, you know, what's the point of doctors offering their advice, for example? Or if someone is eventually going to get unwell, what is the, you know, is prevention better than cure, etc. Shivas?
Yeah, I think that's absolutely right. And that does, that ties into, you know, this case very specifically. I think futility, someone said, where something doesn't have an effect. So it's sort of that. I think someone else has got it actually. It's basically to do with the fact that a treatment isn't worthwhile. It won't have as much of an effect that is necessary to ensure that the patient has a good well-being. And the two types, quantitative and qualitative is to do with the kind of numerical effectiveness of a certain treatment, you know, i.e. the success rate. And, you know, yeah, someone said it can link to life expectancy years. Yeah, so the idea of kind of, you know, whether a treatment is going to be effective or not, whether it's actually likely to be effective. And qualitative is to do with the quality of life. It's to do with the fact that whether treatment will actually have enough of an impact to significantly improve a patient's quality of life. And in this case, it will be both types of futility that were looked at. Great Ormond Street made a decision based on the fact that the treatment wouldn't have a high success rate, and also that it wouldn't significantly improve Charlie's quality of life were it successful, considering the fact that Charlie already had significant brain damage each week. So yeah, thank you everyone for your comments on that. And someone's added, I think the treatments should still be allowed even if it is thought to be futile, as if it is successful, it could prove to be a useful treatment for future disabled people. Yeah, that's very true. But of course, that, we can't assume that these treatments, if they don't work, they'll have a kind of neutral effect on the patient. There's always a likelihood that these treatments could damage a patient even more. And that brings up the argument as to whether it's ethical to carry out those treatments if you're, actively causing damage to a patient. So that's the kind of balance you have to get there. And yeah, as someone's mentioned, there may very well be lawsuits if treatments don't work. If experimental treatments fail, then people will say, people could get sued. It could provide a lot of damage, both emotionally and physically. And someone has agreed that it could provide false hope for patients and their families. So all of this we have discussed in our futility session, and that's the problem with experimental treatments.
I was just going to say also the idea of legal action would also be considered, because obviously doctors have a moral duty and also a legal duty to provide the best care. And if they're experimenting, even if it is on the basis of what the parents say, unless there's very clearly defined legal paperwork saying that, we do not take any legal blame for anything that goes wrong if the parents are pushing for an experimental treatment, that's quite dangerous, because first of all, that's not in the idea of a doctor's duty or in the moral sort of area of a doctor's duty to be legally exculpated from a certain area. They want, doctors want to take as best care as possible, and therefore if something goes wrong, it is their fault, and they would want to take, a good doctor would want to morally take the blame for that and want to improve himself and make sure that something better happens. So the idea of experimental treatments is very, very difficult. And that's why, as we did in the previous session, it's very important for every treatment, drug and vaccine and every single idea to be heavily, heavily, heavily experimentally founded in research. Obviously there's animal testing, there's testing on isolated cells, and testing on a greater range in, on actual humans, etc. So whereas somewhere else, for example, algorithms, etc., it may be easier to use experimental ideas and theories. In medicine, it's a very difficult idea to use, to experiment on live patients whose lives are on the line.
Mm-hmm. Yeah, I absolutely agree. And that's why there is such an issue. That's why there was such an issue with thalidomide, for example, because things like that couldn't be tested without exposing vulnerable people to a drug. So it is difficult, and there is no really correct answer. And sometimes risks have to be taken in order to ensure a patient's safety, and unfortunately, that doesn't always lead to success. I think we've more or less covered all the points on this slide. I think that is the last slide we've got in this session. So yes, thank you everyone for attending. I wonder if you have any final comments or questions regarding the idea of disability, something that you think about. Do you think society should adapt to disabled people, or do you think that we should invest more in treatments for disabled people? Do you think, for example, we should try and invest into treatments for blindness, for deafness, for conditions like autism, or should we instead move to a society where we're trying to facilitate and accommodate these people's conditions? So if anyone has any final ideas regarding that question, then please do put them in the chat, or you can unmute yourself and explain out loud. I can see someone's got their hand up. Do you want to speak out loud, perhaps?
Hi, can you hear me?
Yeah, we can hear you.
Yeah, so I think in the long term, we should be maybe considering more about treatment, but I don't think there's a case that it's either treatment or facility. I think we can do both.
Mm-hmm. Yeah, I absolutely agree. And I think whilst obviously, having a cure for deafness would provide a huge impact and a huge benefit to people, we know that we're years and years away from that stage. And so whilst we can still invest in research and trials into, improving these conditions, at the same time, as you said, it should be important to try and facilitate these people's needs in the society of today. Does anyone else have any other comments or questions they'd like to add?
Before we get into that, I just wanted to say thank you very much for coming. I know that we had fewer people than normal, but I think we did get some messages saying they have exams and some interviews, etc. So hopefully we will resume with a larger number next week. Someone said, what years is this available to and what it's better to? Shivas and I, when we created this, it's mostly for anyone who's interested in medicine and as a career and would like to know a bit about it before application system. And I've given a guideline of about years 9 to 13 when you sort of know what you want to do. But I'd say anyone who can understand basic level biology and medicinal ideas is more than welcome. Someone said, what is next week's discussion on? We're not entirely sure yet, but we will send you a message on Instagram at the medical debate. Shivas, if you want to go to the next slide and show all the information.
Yeah, we will. I think, now is a good time to finish up. So we've got our details here. If you'd like to ask us any further questions, you please do email us on themedicaldebate@gmail.com. Do DM us on Instagram. That's our Instagram, The Medical Debate. And also we have a YouTube channel where we'll upload, sessions that we've had in the past. And you can also comment there. Someone's mentioned Alzheimer's. We have actually had
a session on Alzheimer's. Yeah,
on Alzheimer's.
I think it's on YouTube. You can find it on our YouTube channel. To find our YouTube channel, you can type in The Medical Debate, no spaces like that, and you can find all our previous videos on there. We will be posting this session within today or tomorrow as well onto YouTube, so you can find our Alzheimer's session. Pediatric ethics, that's a very good idea. We might consider doing that in the future and possibly next week. Again, as we said, you can go onto our Instagram at The Medical Debate and find out what we're going to be doing next week. We post slides from these presentations as well. Have there been any debates regarding surgery? We've also had a session regarding surgery, which I don't know if it's up yet, but it will be at some point. And so we can upload that as well. But yes, we have done a session on surgery and it will be on the YouTube channel shortly. Feel free to tell your friends about this. Love to have as many people as possible. Is your YouTube channel just called Medical Debates? No, it's called The Medical Debate. Actually, if you go on our Instagram, there's a link in our bio for the YouTube channel. If you type that in, The Medical Debate, no spaces on YouTube, you can also find it. In fact, I think I'll just send you guys a link right now in the chat for our YouTube channel. Shivas?
Yeah, that would be great. And also in terms of future sessions, if you haven't already, do email us so we can add you to the mailing list, and we'll be able to send you the link for that session. We'll tell you what the topic is about and all of that stuff. And yeah, there we go. We've got the link now to the YouTube channel. So please do subscribe there. So I think that does bring us to the end of the session, really. So thank you everyone for coming. And do ask us any questions that you have, but feel free to leave the meeting when you want, and see you next week, hopefully.
Thank you very much, everyone. If you guys have any questions, please email us or send us a message on our Instagram. We'll get back to you as soon as possible.